Right. Let's dive into something I think we can all relate to. Gum disease.
Oh.
We're going deep today with some research, looking at not just the causes and symptoms, but really kind of why gum health is more important than just, having a pretty smile.
Absolutely. It's fascinating how much gum disease, or periodontal disease as it's clinically called, can reveal about our overall health.
Yeah.
We often, think about our mouths as being separate from the rest of our body, but that's just not the case.
Yeah, and, I was just reading a story the other day about someone who just kind of kept ignoring their bleeding gums, figuring it was just from brushing too hard.
Right.
Well, it turns out they ended up developing full-blown periodontitis.
Wow.
And needing some serious dental work.
Yeah.
It's a wake-up call for sure. This is something that we need to pay attention to.
It really is, and it's a perfect example of how ignoring those early signs can lead to much bigger problems down the line. Periodontitis is no joke. It's when that inflammation goes beyond the gums and starts affecting the bone and tissues that support your teeth.
Oh, wow.
Then you can end up with loose teeth or even tooth loss.
Oh, gosh.
Not to mention pain and discomfort.
So let's break this down a little bit.
Yeah.
What is actually happening in our mouths when we talk about gum disease?
Well, it all starts with inflammation.
Okay.
So think of it like a tiny war going on in your mouth.
Okay.
Bacteria build up, especially if we're not diligent about cleaning. And that triggers your body's natural defense system to fight back.
Yeah.
And this leads to that inflammation, which initially shows up as gingivitis.
Okay, so gingivitis, this is that kind of early stage, right?
Exactly, yeah.
So what are some things we should be looking out for? I'm guessing bleeding gums are a bit of a red flag, literally.
Bleeding gums, especially while you're brushing or flossing, is definitely a sign. But there are other subtle clues, too.
Oh, okay.
Red swollen or tender gums, persistent bad breath. That doesn't go away with brushing.
Oh, interesting.
Even your gums receding, pulling away from your teeth.
Oh, I see.
Those are all kind of early warning signs.
Okay. So those are all things to watch out for. But I'm curious, what causes this inflammation in the first place? I mean, we all know not brushing properly is a culprit.
Right.
But the research that you send over mentions some pretty surprising factors as well.
Yeah.
So
it's true. There's more to it than just forgetting to floss.
Okay.
While poor oral hygiene is a major contributor, there are these other factors that can increase your risk significantly.
Okay, like what? Spill the tea.
Well, for instance, did you know that genetics play a role?
Oh, really?
Some people are simply predisposed to gum disease, even with good oral hygiene.
Right.
And things like smoking, certain medications, even stress can make you more susceptible.
Hold on. Stress can impact my gums.
Yeah.
I knew stress was bad, but this is a whole new level.
It really highlights how interconnected our bodies are.
Yeah.
When you're chronically stressed, your body pumps out hormones like cortisol, which can suppress your immune system and increase inflammation throughout your body, including in your gums.
So it's like adding fuel to the fire for that tiny war we were talking about earlier.
Exactly.
Wow, that's incredible. So even if I'm like a diligent brusher and flosser, other factors can still put me at risk.
Exactly. And it goes beyond stress. Think about what you're putting into your body.
Oh, okay.
Your diet plays a huge role.
Ooh,
if you're not getting enough vitamin C, for example, your gums are more likely to become inflamed and bleed.
Interesting.
Because vitamin C is crucial for collagen production, which keeps your gums strong and healthy.
Okay, so what I eat can directly affect my gum health.
It does.
That makes total sense.
Yeah.
Any other, surprising culprits that we should be aware of?
Well, there are hormonal changes, especially during pregnancy or menopause, that can make gums more sensitive and prone to inflammation. And certain medical conditions like diabetes can also increase your risk because high blood sugar creates a more favorable environment for bacteria to thrive in your mouth.
So it's really like a complex interplay of factors.
Yeah.
It's not just as simple as brush and floss and you're good to go.
Precisely. Understanding the full range of causes is the first step in taking control of your gum health.
Yeah.
It's about being proactive and aware of your individual risk factors.
So we've talked about gingivitis, that early stage, and some of the surprising causes. What happens if we ignore those early warning signs?
Yeah.
What does the next stage look like?
Well, that's when gingivitis can progress to that more serious stage we mentioned earlier, periodontitis.
Okay.
And this is where things get a bit more intense.
All right, so let's dive into periodontitis.
Okay.
Paint us a picture. What are we dealing with here?
So imagine those little pockets between your teeth and gums. With periodontitis, those pockets become deeper, allowing even more bacteria to accumulate. The inflammation becomes more severe, and it starts to attack the bone and tissue that support your teeth.
Oh, wow.
And this is what can eventually lead to those scary consequences we talked about earlier. Loose teeth, even tooth loss.
Yikes, that's definitely not what I want to hear. Are there any telltale signs that gingivitis has progressed to this, more serious stage?
Definitely. You might notice your teeth feeling loose or shifting.
Oh.
You might experience pain or discomfort while chewing.
Got it.
And sometimes you'll even see pus between your teeth and gums. That's a sure sign of infection.
Okay, so if I'm experiencing any of those symptoms, it's time to make a beeline for the dentist, right?
Absolutely. Early intervention is key.
Okay.
The sooner you address the problem, the better the chances of preventing further damage.
This is all great information. So far, we've uncovered some pretty surprising causes and the different stages of gum disease.
Mm-hmm.
But what about prevention? I know we all hear brush and floss constantly, but are there any other, less obvious tips that can make a difference?
You're right. There's a lot more to prevention than just the basics.
Okay.
And we'll be diving into those strategies in detail in part 2 of our deep dive.
I can't wait. I'm already learning so much. This is way more fascinating than I ever imagined.
It's amazing how much we underestimate the importance of our oral health.
Yeah.
But as we're discovering, it's truly a window into our overall well-being.
Well said. Stay tuned for part 2, where we'll explore even more surprising connections and practical tips for keeping your gums healthy and happy. Welcome back to our deep dive into gum disease. I have to admit, I'm still reeling from that last part.
Oh, yeah.
Learning that stress can actually fuel gum inflammation. That just blew my mind.
It's incredible, isn't it?
Yeah.
It really underscores this idea that our mouths aren't some isolated system. They're intimately connected to the rest of our body.
Right. And that connection goes way beyond just stress. In the research that you sent, there's a whole section on links between gum disease and other health issues.
Right.
And that's what I'm so eager to hear more about.
Okay, yeah.
It almost sounds too far-fetched. How can something happening in my mouth impact, my overall health?
I know, it's surprising. But think about it. Your mouth is teeming with bacteria.
Okay.
Both good and bad.
Right.
And when you have gum disease, those harmful bacteria, they have a chance to really multiply and spread. And because your gums are full of blood vessels, those bacteria can actually enter your bloodstream and travel to other parts of your body.
So those bacteria are hitching a ride through my bloodstream.
Essentially, yeah.
And then where do they end up? What happens?
That's the concerning part. Research has found strong links between gum disease and some pretty serious conditions.
Okay.
Including heart disease, diabetes, even respiratory problems.
Well, okay, let's start with heart disease. I mean, that seems like a huge leap from gum disease.
I know.
How are they even related?
It all comes back to inflammation.
Okay.
Remember those bacteria traveling through the bloodstream? Well, they can end up in the arteries around your heart.
Okay.
Causing inflammation and plaque buildup. And that plaque buildup is what restricts blood flow, leading to heart attacks and strokes.
Wow. So the inflammation in my mouth could actually contribute to inflammation in my arteries.
It can.
That's kind of a scary thought.
Yeah, it really highlights how important it is to address gum disease early on. It's not just about your teeth.
Right.
It's about protecting your cardiovascular health, too.
What about diabetes? I know people with diabetes often get told to be extra careful with their oral health, but I never really understood that connection.
Yeah, it's a two-way street, actually.
Okay.
If you have diabetes, high blood sugar levels can weaken your immune system and make you more susceptible to infections.
Right.
Including gum disease.
Okay.
But here's the kicker. Gum disease can actually make it harder to manage your blood sugar levels.
Oh, really?
Creating this vicious cycle.
So it's like a double whammy. Diabetes increases your risk of gum disease, and then gum disease makes it harder to control your diabetes.
Exactly. It's a complex interplay, but the takeaway is clear. Managing both conditions is crucial for your overall well-being.
Right.
If you have diabetes, it's even more essential to prioritize your gum health.
Okay, so we've got heart disease, diabetes. Are there any other health problems on this list of surprising connections?
There's growing evidence linking gum disease to respiratory problems like pneumonia and COPD.
Oh.
Again, the culprit is likely those pesky bacteria hitching a ride in the bloodstream, traveling from your mouth to your lungs, causing inflammation and making you more susceptible to infection.
This is all starting to make a lot of sense. It's not just about keeping my teeth. It's about protecting my heart, my blood sugar, and even my lungs.
It really is.
Okay, so we know prevention is key. We talked a bit about brushing and flossing in part one. What else can we do to keep our gums healthy and avoid these kind of scary consequences?
Yeah.
I'm ready for those less obvious tips that you promised.
All right, you got it. Let's dive into some practical strategies that go beyond the basics in part 3 of our deep dive.
Okay.
We'll explore the power of diet, stress management, and some other surprising tips that can make a real difference.
Sounds great. I can't wait to hear more. See you in part 3. Welcome back to the final part of our deep dive into the surprising world of gum disease. We've covered a lot of ground, from those sneaky causes to that mind-blowing connection to heart health and beyond.
It's been a fascinating journey, hasn't it? And now it's time to shift gears and talk about what we can actually do to protect our gums. We've talked about brushing and flossing, of course, but as promised, let's explore some of those less obvious yet incredibly powerful strategies.
All right, I'm ready to put on my proactive hat. What's the first thing that comes to mind?
Well, you might be surprised to hear this, but one of the most impactful things you can do for your gum health is actually in your kitchen.
Oh.
It's your diet.
Okay, you mentioned the importance of vitamin C earlier and how it helps with collagen production. Are there any other nutritional superstars we should be loading up on?
Absolutely. Vitamin D is another key player. It helps your body absorb calcium, which is crucial for strong bones, including bones that support your teeth.
Okay.
Soaking up some sunshine is a great way to boost your vitamin D levels, but you can also find it in fatty fish, egg yolks, and fortified foods.
Okay, so vitamin D for strong bones. Got it.
Yeah.
What about those antioxidants we hear so much about? Do they play a role in gum health too?
They are essential. Antioxidants help fight those pesky free radicals, which can damage cells and contribute to inflammation. Think of them as little superheroes protecting your gums from harm. And luckily, they're found in abundance in delicious foods like berries, nuts, seeds, and all those colorful fruits and veggies.
So basically, eating the rainbow is a win-win for our gums and our overall health. I can definitely get behind that. But what about those things that we should be avoiding? I'm guessing smoking is at the top of that list.
You guessed it. Smoking is a major saboteur when it comes to gum health. It constricts blood vessels, which means less oxygen and nutrients are reaching your gums, making them more vulnerable to infection and slower to heal. Plus, smoking weakens your immune system overall, so your body has a harder time fighting off those harmful bacteria in your mouth.
So if you're a smoker, quitting is one of the most impactful things you can do, not just for your lungs, but for your gums too. I'm sensing a theme here. Everything is connected.
Exactly. And that brings us to another surprising culprit, stress. We talked about how those stress hormones can fuel inflammation, and this applies to your gums as well.
So managing stress isn't just about feeling calmer and more relaxed. It's actually a proactive step towards healthier gums.
Absolutely. Finding healthy coping mechanisms, whether it's yoga, meditation, spending time in nature, or talking to a therapist, can have a positive impact on your overall well-being, including your gum health. It's all about reducing that chronic inflammation.
I love this holistic approach. We're not just talking about isolated treatments, but lifestyle choices that support overall health. Now, I have a question about something that's always a bit of a debate. Mouthwash. Is it a must-have or just an extra step?
Mouthwash can definitely be a helpful addition to your routine, especially if you're prone to gum disease. Look for an antibacterial mouthwash that contains fluoride for extra protection against those harmful bacteria.
Great tip. While we're on the topic of oral hygiene, any advice on choosing a toothbrush? I feel like there's so many options out there.
You're right, the toothbrush aisle can be overwhelming. Here's the key. Always choose a soft, bristled brush. Those hard bristles might seem like they're cleaning butter, but they can actually damage your gum tissue and make you more susceptible to inflammation.
Wow, I never realized that. I've definitely been guilty of using a hard bristled brush in the past, thinking it was more effective. Learn something new every day.
And don't forget to replace your toothbrush every 3 to 4 months, or sooner if the bristles start to fray. A worn-out toothbrush won't clean as effectively, and it can actually harbor bacteria.
Good reminder. Now, what about those little interdental brushes? Are those worth adding to the mix?
Interdental brushes can be really helpful, especially if you have spaces between your teeth where a floss might not reach as effectively. They can help remove plaque and debris from those hard-to-reach spots.
So they're like a little extra insurance policy for those of us with tricky gaps.
Exactly. And speaking of insurance, let's talk about what happens if, despite our best efforts, we do develop gum disease. Is it a lost cause?
That's a great question. I think a lot of people feel like once they have gum disease, there's no turning back. But is that really the case?
It's definitely not too late. If you've been diagnosed with gum disease, your dentist will create a treatment plan tailored to your specific needs. This might involve a professional cleaning to remove plaque and tartar buildup, antibiotics to fight infection, or, in more severe cases, even surgery to repair damaged tissues.
So there's hope, even if you've already been diagnosed.
Absolutely. The key is to catch it early and work closely with your dentist to manage the condition and prevent further damage.
This has been such an eye-opening deep dive. I feel like I have a whole new understanding of gum health and its impact on my overall well-being.
I'm so glad to hear that. And remember, your mouth is a window into your health. Taking care of your gums is an investment in your overall well-being.
Well said. And to our listeners, we hope you've learned a lot about this often overlooked aspect of health. Remember, brush, floss, visit your dentist regularly, and make those healthy lifestyle choices. Your gums will thank you.
And don't forget to smile.
That's it for this deep dive. We'll catch you next time for another fascinating exploration. Until then, stay curious.